I'm Dr. Senthil Velan, consultant orthopedic surgeon. So today we are having this live Facebook session on bone and joint problems and how to actually address them in this very difficult times. Um, because sometimes you might have significant problems in your back or your neck or even shoulder, and then when to actually reach out to the hospital, when can be managed at home, when to actually even just do a teleconsult and take medications. We'll try and answer your questions as much as possible. But before we actually go on to answering your questions, I just want to emphasize the importance of social distancing. I'm sure we've been told again and again regarding the importance of social distancing in this difficult situation of the coronavirus situation. But it is very important that you maintain that what the government is actually advising us. So it is very important. Unless it's an emergency situation, unless it is like an emergency where you have to reach to the hospital, then you need to get to the hospital. Otherwise, there are different forums, different methodologies by which you can actually reach us. Healthcare Travelers Worldwide is actually providing you with numbers where you can actually contact them, and subsequently they will direct you to teleconsultation with multiple specialists. Right from orthopedics to gynecology to diabetology, to ophthalmology. Any multiple consultants are available in the forum. So we will actually put you in touch with the relevant doctor so you can actually do the consults. So in regards coming to the orthopedic problems itself, first of all, I get a lot of my patients contact me over the phone, and I am presently doing WhatsApp consultations. There is a specific guidance from the Indian Medical Council of India how we have to do the teleconsultations. Otherwise, hello Kavita, I'm actually on live now. Can you see? No. Oh, okay. Sure. I'm already started talking. I don't know people whether they are able to see me, listen to me. Maybe they can comment on. I know, but I cannot see how many people are actually seeing it, isn't it? So I don't know. Yes. Sorry. So it's very important actually we maintain this. Wherever you are, whichever country you are, it is very important that you maintain this, because there are specific reasons why we have been told that that we have to maintain the social distancing, because at the moment there is no vaccine yet. At the moment there is no specific cure yet. So, and because of the risk of the spread, what we call as RO, which is more than 1.8 to 2, which means that one person can spread to even two persons. Subsequently the infection can be spread quite fast, and the significance of these infections are quite high in elderly population, and they can actually succumb to these infections. So it's very important to maintain social distancing. There's no doubt about it. It is not like they're just advising to keep us just socially isolated. No, at the moment there is no particular cure right now. So it is very important that we reduce the amount of spread. So with that message, we'll go on to the specific bone and joint problems and spine problems, and then a brief introduction on what problems you can actually expect to have, how to actually address them, and subsequently I'll answer the questions. You can just post them on the live Facebook session here, and then I'll try to answer as much as possible. So to give you a basic outline, common problems that we can actually get is the back problems. People might be having back problems in the past, and then subsequently now the pain becomes worse. A lot of stiffness in the back is quite common. So it is very important to have a good schedule. What is important is that doing like regular stretching exercises is very important. It's very difficult to actually keep our spirits up, and then to actually in these difficult situations. But it's important to have a schedule every day morning. You are at 7 o'clock, you get your friends together on the WhatsApp or Facebook, and then you form a group, and subsequently do like simple stretching exercises for your back. which is very important because low back problems and low back pain is a very common problem, especially if you're not doing enough walking, which you're not able to go outside. So in this page we will actually share some simple exercises which you can actually do, and then these exercises will train you to get a stronger back, prevent the significant amount of pain. And if the pain is not getting better and the pain is becoming worse, like about like 8 out of 10, 9 out of 10, then in that case, then you need to contact your doctor over the phone first, and then they will be able to give you advice. As I said, we'll share numbers here where you can actually contact us, and then we can able to give you teleconsultation on what medicines to take. You can get the medicines locally and try and take them now. And then if it is not getting better, when do you have to go to a doctor, orthopedic doctor, in case of an emergency in your back? Is that only when you develop numbness in the leg, or when the pain is unbearable that you cannot actually manage at all, which means that you've tried medicines, you've tried exercises, you've tried hot fermentation, and then even with the medicines and complete rest, and even with that you're not able to actually move around at all, and you're starting to develop any numbness or bladder bowel problems, you're starting to lose control of your urine, or going to the toilet. Those are the situations are real emergency, and it's very very rare. If you take 1,000 patients, probably about one or two patients may have a real emergency like that which needs to be addressed, but everything else it can be managed right now at home, and they can wait for things to settle down now, and then with tablets and medications. And then if the pain or the problems happen, then you need to consult your orthopedic surgeon in person. The reason why I'm saying is that when we actually get to the hospital, again, there is a risk of actually cross contamination, getting, infection from the other patients, who might be there. So it's very paramount that you actually get the consultation only when it is absolutely necessary in person. In other times, we will be able to guide you through what kind of treatments you can actually get at home. So I think we'll move on to the questions here. In fact, we have Vaishali here who's actually asking any particular supplements that you can actually use for having knee pain while climbing stairs. Yes. What is important here is that knee supplements. Yes, if you actually take what is called as glucosamine and chondroitin sulfate. I don't know which part you are actually from. If you are in India or anywhere around the world, the generic name of these supplements is called glucosamine and chondroitin sulfate. These are actually joint supplements which actually increases the amount of fluid inside your knee, and these will actually help in your joint lubrication in the knee, and that subsequently helps in kind of like reducing your pain. But more important is if you have like a kneecap which you can actually get nearby, you can actually use that and do what is called as quadriceps exercises. Most often these knee pain is caused by what is called as patellofemoral arthritis, where the kneecap rubs behind the femur bone and subsequently causes irritation and early pain, and the fluid builds up. So what we generally do is that give them supplements, and also give you a kneecap. You can actually use them at this point, and also use hot fermentation. This also will help, and also try and limit your activities. If you're getting a lot of pain, this is not the right time to be doing any significant activity. So it is important to reduce the amount of activities, and then try and get the pain down. So that would we'll also try and share some knee exercises if possible on this page, at the end of the session, so which you can actually follow them, and then you can take help. And if the pain really gets worse, you can always have a one-on-one video consult with us, and then we can actually discuss with you. So there's another question from Nishita Rane. What symptoms suggest that I will need to get a knee replacement? And for this actually we need to get a lot of more information, because right now, as I said, all elective surgeries in the foreseeable future, which I mean that at least minimum of 2 months I would foresee we wouldn't be able to do them, because it is not an emergency. So symptoms of knee replacement is unbearable pain if you're not able to get to walk even at home, and you're not able to walk to 100 meters, not able to do your functional activities. All this would suggest that you may need a knee replacement. If we clinically establish that you have knee arthritis by using x-rays, and also examining you, making sure your ligaments are okay. So right now, obviously in this situation, a knee replacement, is not an advisable surgery because it's not an emergency surgery. So there's another question by Shravani. Is it safe to do bilateral knee replacements? A number of studies, in fact, when I was in the UK, we were regularly doing bilateral knee replacements at the same time because arthritis affects both joints at the same time. It only is logical that you actually do bilateral knee replacements, and we have done them in a lot of situations. But nowadays, the general advice is that as the patient is older, the more older the patient is, or if they have any significant comorbidities like diabetes, hypertension, and all the situations, or any lung issues, we generally do one knee replacement. In our institute, we do one knee replacement to start with, and we give it like about like 10 days. And at the same admission, in the time, we actually keep the patient in the hospital. And at the second sitting, once the patient actually is recovering from the knee replacement, then we do the other knee replacement. So it's almost like two knee replacements, but in the interval period, because the amount of insult or injury to the patient at one time becomes less. So a bilateral knee replacements, yes, in a very young patient, yes, we tend to do. But nowadays, the principle in practice is to do bilateral knee replacements in at least a space of at least 1 week to 10 days time. So there's another question by Shivani, which says, since I'm not going outside in the sun, will my bones be affected due to lack of vitamin D? That's actually an interesting question because vitamin D, as we all know, we have cells in our skin which actually converts the light, and then this 7-dehydrocholesterol, ergocholecalciferol is the scientific name for the vitamin D. It is it is converted to an activated form in the liver and then in the kidneys, and then it becomes an active form of vitamin D, which helps in calcium absorption. So what is important here is that yeah, if you have an access to a terrace, and especially, it is not during the middle of the day like 12 or 1 o'clock, but in the early mornings, like not like about like 10 or 11 o'clock, where there is not too much sun, and in the late evenings are actually good because the angle of the rays are actually much better to actually get good sunlight. But you're not able to get out all that, you can actually stay in the balcony for about 20 minutes, or even get to the rooftop if it is safe to have a good social distance and still have it. It is actually not only good for your vitamin D, but it is also good for your mood, because we as humans, we're all dependent upon the sun, and when we actually staying in closed spaces, we tend to have a lot of mood depressions as well. So it is important to get at least some amount of sunlight, keep your windows open during the day, and make sure you have a routine. That is the more important. You have to, like, have your breakfast, have your tea, and subsequently keep 20 minutes to actually go in the sun. Or if you know Surya Namaskar, and you can actually do them, brilliant. You can do in the morning and then do it. So all these small things can actually help, even without going extensively outside for a walk. Yes. So if you have been advised to take vitamin D supplements in the past, yes, it is important to continue with those vitamin D supplementation, because especially for women over 65 or over 55, the vitamin D and calcium levels tend to drop. And it is important to continue taking these vitamin D supplements, so that you're not getting enough amount of vitamin D through the sun. You can actually supplement through tablets. So I think that probably answers the question asked by Ash as well. Who needs to take calcium supplements? Calcium supplementation is important wherever you need more amount of calcium, where you're not getting it through your food. So young patients who are, like, fit and well, who take enough of vegetables, enough of dairy products, you don't routinely need calcium supplements. Calcium is required mainly by postmenopausal women. That's very important. Over 45, over 55. Generally what happens in women is that because of the estrogen that is not present after the menopausal period, the protective effect of the estrogen is lost, and they tend to start losing about 3% of calcium every year. So that's why it's very important for women in the postmenopausal period to take calcium supplements. Obviously, you will have to take calcium during your females during their breastfeeding period. It's very important because of they lose calcium through their breast milk. And young population, the pediatric population, they need to take calcium supplements because of the growth of the bones. But the adolescent age group, the middle age group, you don't really need a routine calcium supplement. Okay, next question is by Murtuza. My cousin is 24 and he's overweight. Could weight be the reason for his knee pain? Mechanically, yes, he is very young, and if he's having significant amount of knee pain, we have to actually see him in person, really take some x-rays, establish what is the kind of problem he's having, whether it is a kneecap patella problem, because the kneecap problems, patellofemoral arthritis, or whenever there is increased weight, what happens is increased amount of load goes through your kneecap, and then this actually causes pain. And in a young patient, we see a lot of patients with what is called as a chondromalacia of the patella, which means that the more amount of weight goes into that of the kneecap, and then what happens is that the kneecap starts rubbing against the back of the knee, and the patients develop a lot of pain. So we generally advise weight loss by means of safe dietary methods and exercises which can not impact their knee. And this definitely helps, because about 4 to 5% of weight loss also decreases the amount of load onto the knee significantly, and the pain reduces. Yes, weight can be one significant reason for knee pain, but that's not the only reason. There can be multiple reasons, and we need to really establish it by doing investigation, seeing in person, and then doing x-rays. So another question from Yogender: what is unicompartmental knee surgery? It is actually because your knee is basically having really four compartments. It's actually the inner compartment called medial compartment, outer compartment called lateral compartment, and in between there are ligaments, and in the front there is also the patellofemoral component. So when we actually are doing a knee replacement surgery, when we actually say it's actually, we replace the whole of the knee. That's called the total knee replacement. But nowadays, in younger patients, we tend to preserve those ligaments and replace only one compartment. Like the medial compartment, we just replace the tibia, the leg part, and also the femur, the thigh part, lower end of the thigh part alone, leaving the ligaments intact. So this is called as unicompartmental knee replacement. The advantage of this is that you don't damage the other ligaments, you don't take away the ligaments, you don't damage the other part of the knee which is intact. So which helps in better activity, more activity, and there is always an option that in the future, if you need to replace the rest of it, there is an option that you can do a total knee replacement. So next question by Malarmati is: is it advisable to use stairs daily when you have arthritis knee? It again depends on what kind of stairs you're using and what type of arthritis you're having. Especially if you have significant arthritis, it is not that the using the stairs is going to worsen your arthritis. No, it is not that way. Because arthritis itself is a genetic, a problem where there is a problem in the cartilage, there is a wear out of the lubricating structure within the knee, and that causes significant amount of wear out of the knee and subsequently pain. So using the stairs itself is not the problem, but you will not be able to do it because you have arthritis. It is more like that. So generally, I advise my patients is that, if you can walk on flat surfaces and if you can do non-impact exercises, those are good for a knee joint arthritis patient, because it doesn't cause too much pain, and still you can do those exercises. What can be a temporary household remedy for knee pain? Household remedy for knee pain, generally, if you have a lot of knee pain, especially due to arthritis, all anti-inflammatories which you can actually take at home will help. We know that, generally the turmeric and all has anti-inflammatory properties, but these are long term. If you take a lot of turmeric, yes, in your food, it helps in antioxidant properties and helps you reduce some amount of knee pain. But what if you have acute knee pain? Generally, we generally tend to keep at least ointments at home, you can actually use them and use hot compresses instead of cold compresses. You can use a good cloth, and then warm it up to adequate temperature, and make sure you can actually tie it around your knee and take adequate rest and do simple exercises which can actually help in reduce your knee pain. Next, another question: what is the best time to take calcium tablets in a day? There is no particular time. Once you actually start taking tablets in the morning, you just keep it up to the same, time, so that you don't miss them. So it's not like you should take them only in the afternoon or evening. So it doesn't matter what time of the day you actually take, because absorption takes place all throughout the day. My cousin is facing shoulder dislocation from last 2 years. Is there any permanent treatment can be done? Question by Karan. Yes, shoulder dislocations happen in very younger patients, especially after an injury. Then subsequently, what happens is that there is a damage to the structure called the labrum around the shoulder. There is a shoulder is a ball and socket joint, and the socket has got a lining that's called as a labrum. And subsequently, what happens is that once the first dislocation happens, and then the patient goes to the hospital and has it reduced, and they get okay. But after that, subsequently, the patients have what is called as apprehension. Whenever they're trying to lift out their shoulder, and try to actually move around, then they start developing, apprehension that they're not able to do it, and then it can actually sublux, or they have a feeling that it may slightly come out. So this is a important problem that happens in younger individuals. They're not able to carry out their daily activities. In these situations, what we do is we generally do an MRI, and then find out if the labrum, it's called a Bankart lesion, which actually the labrum in the front of the shoulder socket gets damaged. It doesn't heal normally. So if the patient is having particular problems or recurrent shoulder dislocation, it keeps happening again and again, then we advise exercises, and the exercises doesn't help. We do a keyhole surgery, arthroscopic shoulder surgery, to actually repair that labrum back in position, and the patients usually do quite well. But to return back to sports, it takes about 4 to 5 months, but then they generally do really well after that. So yes, recurrent shoulder dislocation in a young patients, we generally do what is called as an arthroscopic Bankart repair current. So another question by Varunika says, do arthritis and varicose veins go hand in hand? There is actually no relationship between arthritis and varicose veins. Both are actually different, problems altogether, because arthritis is actually a joint problem, and varicose veins is actually a vascular problem. Because varicose veins, as we know, is that the blood is pumped back from the vessels back into the heart, and then they have got valves, and these valves become problematic, and so the blood is not being able to pump back in the heart properly, and so you get bulges in the veins, and this is actually what known as varicose veins. Generally, what happens is that the arthritis and the varicose veins, they coexist, because people are not able to walk enough, and so there is a lot of swelling, and so this swelling itself, can contribute to edema in the leg, and it becomes more contributory. But generally, there is no active relationship between that of varicose vein and arthritis, but they tend to coexist rather than actually being causative. Can calcium supplements be avoided by consuming regular food? Question by Shivani. Um, yes, I mean, calcium supplements, as I actually already mentioned, is that it is required only when you are actually deficient. Uh, Only when, for example, young patients who are taking enough amount of calcium by regular food, like if you're taking regular dairy, if you're taking regular, eggs, and all that, it doesn't really, need to be supplemented, especially for the younger individuals. But postmenopausal women, they tend to lose calcium, as I said, already, like about 3% of body's calcium is actually lost every year, because the protective effect of estrogen is lost. So in those patients, definitely we advise calcium supplements. But routinely, a 20-year-old female or a 20-year-old male doesn't require a routine calcium supplement. They can be just be additive in their foods. And then any specific food stuff to consume as a natural remedy for a calcium deficiency. As I said, already the dairy products, every day we can actually, what we'll do is that we'll just share some at the end of the session, like milk, cheese, dairy foods, vegetables, soya, nuts, and especially if you are able to take food, fish, then these are all rich in calcium. So we can actually share some details of calcium rich foods you can actually start consuming or keep adding to your food. A question from Rajani Anand. If I walk for more than 15 to 20 minutes, my leg starts hurting, and if I take rest, I'm fine. What could be the reason? The knee pain, again, it depends on a number of the leg pain. What you're mentioning is actually leg pain. There are a number of reasons for it. You need to actually, make sure that you have a consult with your doctor. But if your pain is actually happening after a period of time, we need to check for what is called as varicosity, varicose veins, blood vessel problem, or there can be a problem, in what is called as in the blood vessels that supply your leg itself. That's called as a claudication pain. So if it is due to muscular pain, generally it tends to happen only at the end of the day after you're walking. But if you're having to stop after every 10 minutes and you're unable to carry on with your walking, you need to consult with your vascular doctor to make sure there's no problem with your blood vessels in a period of time. Another question: at what time can we consider knee replacement surgery for arthritis? Knee replacement is an end stage solution. Uh, it's an end stage solution. So whenever you need to have a replacement, if somebody's orthopedic surgeon is suggesting knee replacement, it generally means that the all other conservative options have been exhausted, like physiotherapy, supplements, analgesics, medicines. So only when the patient is unable to carry on with their normal activities, let's say somebody is unable to get to the shop and get back, unable to get out of their bed, every day the pain is becoming so severe that if you put a scale of pain, 1 to 10, and 10 being very very severe and 0 being no pain at all, if somebody is saying my pain used to be 3 out of 10 and now it's become 8 out of 10, it's become 10 out of 10, that is actually the time to actually consider replacement surgery, because knee replacement surgery as such, it's a pain relieving operation. If the pain is severe, unable to walk, difficult to carry out with everyday activities, yes. If somebody is saying, I don't have much pain, my pain is about 3 out of 10, I can manage most of the activities, but I'm actually not able to sit cross leg. Uh, that's not an indication for knee replacement, generally. You know, in fact, in such situations, we should be considering other options like physiotherapy, maintaining good health, weight loss, carrying on with, activities that actually will reduce your knee pain. That is what will be the solution. Only when the pain is severe, impairing normal functional activities, that's when knee replacement should be considered. Obviously, the X-ray should corroborate with it having significant amount of knee arthritis. Next question from Murtuza. My grandmother is 87-year-old and she's unbearable knee pain. How can I help? In obviously, we'll have to, make sure we can have a teleconsultation, see, get some X-rays of the knee. If you have already X-rays, you can share with us, and then we can actually see that and advise accordingly, Murtuza, about what kind of treatment we can give in terms of like medications, and also we can set up a video consult. Probably that will be a better, rather than giving generic advice and saying how do we help her. Generic advice would be to give her adequate supplements, adequate rest and exercises, but generally to give her medications we need to know her medication history, the amount of pain that she has. I'm just getting a phone call, can I just answer this? Sorry. Solomon. Hello, Solomon. Hello. Sorry, sorry about that. So yes, so we will probably set up a video consult. You can contact our admin on the Healthcare Travelers Worldwide, Murtuza, and we can set up a video consultation that we can specifically advise on that. Next is Mrinalini. When I do ab crunches lifting my leg above, I have some discomfort in the left leg near the upper thigh as I hear my bones crunch and move. Um, Whenever you're actually, if you're used to actually doing ab crunches regularly, and you're actually feeling some amount of noise, it usually is secondary to rubbing of the tendons. And if the pain is not severe, generally, it is nothing to be afraid of, nothing to be worried about. But if you're starting to have pain which is which is limiting even your lifting your leg, and the discomfort becomes like pain of 8 out of 10. That is the time to actually stop doing those crunches for a while, for about 3 4 days. Rest, do stretching instead of actually crunches, and then let the pain settle down. Just to give you an example, I'm trying to do exercises every day, and then 2 days ago I had significant back spasm. Whenever you're trying to actually do exercises with the injured muscle, the body is trying to tell you that when you have some discomfort, you tend to try and stop for a while. The muscles will tend to recover. Those times, you take adequate, measures, that you can have hot compressors. You can use, generally available over the counter painkiller gels like Volani gel or sprays, and then let the symptoms settle down. Then you start doing the exercises again, because at this time, generally it's not advisable, as I said in the beginning of the session, to just walk into a hospital for minor ailments, so that in that way you would be actually picking up, there's a chance of picking up infections from others. So it's important to actually try and stay at home, keep the morale up, do everyday exercises for your back, shoulder, neck. Make sure we can follow this and get through this difficult period. So I think we are almost done about 30 minutes, and most of them have asked their questions. And what I would actually, conclude by actually, if there are no more questions, what I would actually conclude is that it's important to keep the morale up, and exercises definitely helps to keep your morale up, because it not only stretches your muscle and keeps the pain away, it tends to increase your endorphin levels, and make sure that you are actually able to carry out your everyday without significant amount of lowness in mood. So it's important to actually do back stretching, neck stretching exercises. That's very important. We will, as I said, we will share some exercise protocols in this page, so you can follow them. One question from Cheryl. My right hand little finger hurts even with the slightest of the movements. It's bearable. I do not remember when it hurted. It's been a month now and I feel the pain. So if you have not had any significant amount of injury to your finger, and then your finger is starting to have pain, the commonest problem is called as a trigger finger. Trigger finger essentially means that whenever you have the tendons that are actually going to the muscles, and you're starting to have pain in this region, and generally with the movements of the finger, the pain gets worse. Uh, there is a sheath that covers around the tendon, and that becomes inflamed in some situations, and those situations you tend to develop pain, and if it is left, people can start developing what is called as locking symptoms. Generally this is nothing to be afraid of. Generally you can take some anti-inflammatories which are at home. Do some hot compresses right now, and generally you can take some, if you're not allergic, you can take some brufen at home, and it tends to reduce the symptoms, and start doing gentle stretching exercises at home. This will actually help in reducing the symptoms. If it continues to be a problem and it continues significantly, then you may need to see your orthopedic surgeon and have sometimes an injection at that point, which will relieve the symptoms. So right now, if the symptoms are very bearable, I would just carry on with just stretching, and also doing some taking some anti-inflammatories right now. Sorry, Wasim. I think Wasim has left a message, so I'll try and see if I can translate it. Oh, sorry. Wasim is the translator here. Okay. So we'll continue, and as we get more questions, we'll try and answer them. Yogender, oh yeah, thank you. Um, Yeah, welcome. And in case if you need, as I said, more help during the sessions, or if you need more advice, we are generally open. We will share some numbers with you, and we are trying to do as much as help as possible using these teleconsult. And also, you can contact us using the numbers which will be provided in the healthcare travelers worldwide, and they're doing a tremendous job. A lot of our doctors, they'll be part of the sessions, and subsequently this is the orthopedic session we are trying to do. But there will be more sessions coming up on different topics, and I'm sure you can help them. So that's my daughter trying to. I mean, I'm just doing a session. Official session. Sure. I think that brings us to the end of this bone and joint session. And subsequently, if a lot of people are asking questions, then we can do another bone and joint session on particular relevant topics like knee arthritis or hip arthritis, shoulder frozen shoulder problem or neck problems. We are happy to actually continue giving these Facebook live sessions as and when required. Thank you very much for joining us. And if you have any questions, just post them on our page and we'll be happy to answer them. And also, if you have any specific queries or health related queries, and you want to address them, we can actually provide a teleconsultation or a video consultation. Just contact the number that will be actually provided on the Healthcare Travelers Worldwide page. And moreover, we will be sharing regular advice on this Facebook page on how to do back stretching exercises, how to do shoulder stretching exercises, how to address common problems like knee problems, knee pain, how to actually when to actually reach the hospital, when is it an emergency, and if you have like small ankle sprains, what to do. All this we'll try and put together into small slides or small talks, and and then we will actually regularly share them so that it will be useful in this difficult times. Stay safe, stay isolated. We will all get through this. Thank you.